So the whole point of this podcast and what makes it different is the fact that people focus on businesses, people focus on success, but actually very few people look at how they achieve that success. And when you get to a certain point in life, a lot of people forget the journey that they went on and actually look back in rose-tinted goggles. So I'm trying to seek out people who are still pushing and still driving and looking at what they're doing differently that other people can maybe apply to their own lives.
100%. And I think you're absolutely right in the sense that in this kind of insta world that we live in, people just look at the end outcome. So sometimes in between, especially like even in my field, you can put a before and after picture up of something and people automatically will just assume, wow, within the click of a finger, that result was achieved, but they don't know the hard work that's gone into it.
So I guess we'll start with, maybe give us a bit of a background. So sort of talk about what you're doing now and tell us a little bit about the success you just had in terms of, well, you can tell it because you do it better.
Perfect. Okay, so I'm Dr. Ansar. I work in Manchester and Liverpool, cosmetic dentist. And essentially, it's all about, for me, helping patients holistically. So basically, it's not just about your smile. It's about a lot more than that. So, you know, my day job is transforming smiles. And as a cosmetic dentist, it's amazing to be able to do that. But it's about so much more than that. So it's about actually treating patients as human beings, trying to change the vision that everyone has of dentistry, the image that they have of us being butchers, and kind of it all just being pulling teeth out, drilling and filling and all that kind of stuff. So it's trying to put like a more modern kind of spin on it and just allow patients to realize that there's so much more to going to the dentist than just to have your tooth drilled or to have a tooth pulled out. So that's kind of my day job and what I do. And yeah, it's amazing. It's a passion and hobby for me, to be honest.
And you've just been awarded something.
I've just been named as one of the top 50 most influential people in UK dentistry, which I'm so humbled about, to be honest. It is amazing, and honestly, it's a huge achievement, and it's a fantastic milestone in my career. But it's humbling at the same time because there are so many people who aren't even on social media and Instagram who I know in my profession makes such a big difference. So honestly, it grounds you and it humbles you a lot. But it's so nice to be recognized. And it's like we were saying just then, sometimes you can put so much effort in over such a prolonged period of time. And then all of a sudden you start to get recognition in different ways. And when you get that recognition from your own profession and your peers and colleagues, it does mean a lot.
So I guess dentistry is one of those, my perceptions of it is one of those traditional sort of environments. I put it up there with the likes of law and the likes of, I don't know, other sort of just like insurance and stock trading and those sort of firms, they've got a long history going right back to before anyone even remembers. And as a result of that, they've got a very standard way of working. Now, the reason, again, I wanted to speak to you is because I've been to your dental studio and I've seen it's very different, and I've seen you're very different, and the staff, even the walls are different. And that's something I've not been used to, I've not been accustomed to before. And that's what stood out to me. So what do you think, first off, what do you think people think of you in your industry and what you're doing?
I think definitely I have kind of stepped away from the norm, and I've always kept the patient in mind. So I'm so glad you've just said what you've said, because that is my aim. I want people to come and see me and to think, you know what, this guy is different. He's not your run-of-the-mill dentist. He's not just like any other kind of dentist with that classic old school image of, you know, drilling and filling teeth and pulling teeth out and then, you know, hi, bye, you know, kind of open your mouth, that very old school paternalistic relationship that dentists often had with their patients. That's what I'm trying to change. I'm trying to change the entire journey and experience for the patient. I want them to get to know me as a person, which is why even through my Instagram, I'll often put things out there which are just like little snippets of my life, just to let people relate to it and just to see, you know what, actually, he's just like any other person. He works out, he bakes cakes, he does all the usual stuff that normal people do, which I think people in our profession in the past and in a lot of the professions you've mentioned have maintained professionalism, but almost, in my opinion, they've gone a bit too far with it, and it has detached them from their clients, it's detached them from their patients and all the rest of it. So I think it's about kind of defining that connection that you have with your patients and just ensuring that the patient has a pleasant journey, which is very patient-centric. So it's all about the patient, it's all about putting them at the center of it and giving control back to patients as well.
And this isn't something you just came up with overnight and thought the next day, I'm going to do this. So where's this sort of viewpoint come from?
Absolutely not. Exactly as you said, it's something that develops over time. So for me personally, it developed from my own experiences going to the dentist as a kid. My parents would take me. I would be forced to go. It was an environment I absolutely hated. I remember crying in the dental chair numerous times. I remember once having to have a baby tooth pulled out, and I remember thinking, I am never coming back to this place when I'm older, and I've got that control. You know, obviously as a child, you do what your parents tell you to do. You know, they take you and all the rest of it. But once you're older, I remember thinking, this is not a nice environment. These are, you know, quite bad people, and I don't really want to come back. So it's kind of come full circle. And then, you know, I went on to kind of thrive in the science fields kind of throughout school and A levels and all the rest of it, ended up in dental school. And that's when I realized, you know what, I've got the opportunity here to make a change and to make an impact on the profession, which it takes a long time to do, but it's so worth it when bit by bit you see them changes coming about. So yeah, definitely. I think that's where it, personally for me, it spurred from my own experiences as a child. But then kind of as you go through life, you have so many experiences that mold you into what you do and who you are and the way you behave, how you treat people. And I think all of these traits are so important in any business, to be honest.
And so your career path did it very much? I mean, was yours very structured in the sense that did you go school, university, then on and on and on like that?
100%. So with that, so with dentistry, there's not too much that you can deviate, to be honest. In the sense that there are certain boxes that have to be ticked. So you have to get, they are very strict, but you have to get very high grades with your GCSEs. You then have to get X amount of grades with your A levels, which when I was at kind of sixth form, there wasn't even A stars, but now it's like gone all the way up to A stars, and they're including A stars in part of the criteria. So it's very, very competitive. And then obviously after that, you study at uni for 5 years. It's very similar to medicine in that, you know, it's 5 years at uni. It's a long course. And then you've got your vocational training after that. So it's a long pathway, but it's well worth it. I mean, for me now, it's more like a hobby and a passion.
So wait, but like I kicked out of college, me, and I ended up going traveling around and stuff like that first because I just didn't know what I wanted to do. I didn't think I was ever going to go through education. And I guess back when I was in school, it was very difficult to try and choose a path. So there's a lot of kids in there, and they come through college, and they're told to pick a career path. Now, you would have had to have done that to decide you're going to be a dentist back then to get those grades to move forward. So what was your sort of decision-making process there? What was it?
To be honest, I was very much led by what I was passionate about. And that's something my parents instilled into me at a very young age. They kind of said, look, you have to do something you're happy with, regardless of what it is, because otherwise you're not going to last in that job and you're not going to be happy and content. So, you know, I just remember growing up, my parents always saying, do whatever makes you happy, do whatever you're passionate about, because that is what is right for you. Don't kind of, you know, again, with the theme of this podcast, don't, you know, be forced to follow the norms or what you think the norms are. Just do whatever makes you happy and whatever you're passionate about. And for me, that was always sciences. I loved biology, I loved chemistry. And I was always quite artistic as well. So I always enjoyed painting and, you know, doing things with my hands, which essentially marries the two together so nicely with dentistry because it's a very hands-on profession. And on top of that, it's also very theoretical. And with your scientific and academic knowledge you've got to have, it just marries the two together. So for me, it was just a combination of the arts and the sciences.
Would you say that your parents were very influential at an early age then? They
were, to be honest. That's a really good question. So for me, they probably had the biggest influence on me. And the reason why is because growing up, I come from an extremely working class background and what I would call a very basic and simple life that I had growing up. And you know what, now that I look back, Lewis, honestly, them times are some of the best times of my life. So I remember sometimes growing up and I didn't always have the things that other kids had at school and all the rest of it, and we weren't financially very well off at all. But nonetheless, I grew up in an environment where love, warmth, affection probably took precedence over everything else. And I think that is why even now I'm so close to my family, and we've got that really good, strong family kind of ties that allow you to build on so many other things and kind of achieve your full potential in life. So yeah, I would definitely say they've had a massive impact from that point of view, for sure.
And so obviously in this sense, obviously your business is screwing the norm and throwing the traditional out the window because it's doing something completely different, and it's being very effective in that sense. But also your journey into career, although it's seen as the norm, everyone says, "Oh, I want to go and get through school, get great grades, and go to university and get a good job." The actual truth of it is very few people know what they want to do then, therefore they never carry on. They just sort of want to go out with their friends. So I guess my question then would be, who at that point were you spending time with outside of your family, or who were you talking to? Was it other people academically focused?
No, it was interesting. My kind of school friends growing up were all in a very similar position to me. So going through secondary school, none of us really knew what we wanted to do. We just worked hard, studied hard. We were good students, and they were all really lovely, decent friends that I had. And then I remember going to college and still being a bit confused, knowing what subjects I enjoy, but being confused with regards to what kind of route to go down or what profession to enter. Because you're still dead young at that age, and it's always hard to choose something which inevitably, with a lot of things like dentistry, is a lifelong commitment. You don't study dentistry and then end up being a lawyer, or kind of doing something completely different. It's one of those subjects that you study and then you're doing it for the rest of your working life, kind of thing. So for me, it was all about getting to college, continuing with the subjects that I enjoy. And I remember at that time we had an organisation, which I don't know if they're still about actually. They were called Connections, and they'd help advise you on kind of like all your different options and all the rest of it. And I remember sitting down with a lady in Connections, and she said, look, I would strongly advise, with how academic you are and with your kind of artistic side as well, to enter something in the medical field, such as medicine or dentistry. And I remember thinking at the time, you know what, dentistry is so much more hands-on, and it is so much more in line with kind of what I want to do and achieve in future. So I just pursued it from that point.
So that person in Connection has really sparked that, put two and two together 100%. For you, because up until that point, it's just been the path.
Yeah, 100%. And I think had she not mentioned it, to be honest, I probably would have not contemplated it, because at that age, like I say, you don't always know all the specifics of what subjects you want to do and all the rest of it. And I think for me, it was very much about just being guided by her. And she was instrumental, actually, because initially I remember doubting it a lot as well, and kind of thinking, well, I don't know, it's a big kind of profession, and it's a big responsibility, and then there's the potential of not making the grades. And she really pushed me and inspired me a lot, to be honest.
I mean, did you notice that your friends over the years have changed, your friendship groups? Because obviously you've gone into working in your own business now.
Yes. So basically, as a kind of self-employed dentist, you can work in multiple locations. You mix with so many different people and circles, and over time things change. And with life experiences and the experiences that you have and things that you go through, naturally a lot of things change with regards to who you're mixing in with, who you're spending time with. For me, I'm so passionate about dentistry. I literally live and breathe it. Well, outside of COVID, whenever I can go into work, I'm always there. Like, I work 6 full long days a week, and it's always busy clinics. So for sure, I think the people that I'm mixing in with have changed a lot. But the nice thing is, them original school friends that I had, I still meet and I still keep in touch with all of them, and they're all doing really well. We've all gone down completely different paths, but it's just like sometimes them older friends that you have, them oldest kind of friends that you have from being really young, are often the ones who you can be yourself with the most. And sometimes when we're together, we have such a laugh, and it's nice to, again, it humbles you and it grounds you as well. So yeah, 100%. I'm still in touch with them, but my circles have increased a lot since then as well. So it's probably both.
It's nice to hear though that, like, I've got friends from school. I mean, I moved abroad and came back, and then I went somewhere else and came back. And actually, every time I came back, my friends were in school. They never changed. They never grew. They weren't doing anything different. And even today, they haven't. It's really sad. But I sort of moved away from that because I didn't want to be caught up in it. So I've always had this mindset of keeping away from certain types of people and always looking to move forward. But actually, you've managed to keep your group of friends when you were a child. That's quite interesting. So what do you attribute to your, where's the motivation come from? How do you stay motivated, I guess, is the question.
How do I stay motivated? That's a very good question. So to be honest, for me, motivation can't come from any external factor. It has to come from within. And that is the key thing. I genuinely, as cliche and as cheesy as it sounds, I will wake up every morning and I will have at the forefront of my mind, almost like a habit now actually, all the reasons why I want to and need to succeed. And that involves so many different people and so many different things. That involves things ranging from making my parents proud all the way to serving my patients to the best of my ability, and amazing, kind of smile transformations, high quality dentistry, and almost leaving like a mini legacy behind for people to say, you know what, this person made a difference. Even if it's small, even if it's big, you want to make a difference and a positive impact. And honestly, all of these things, to be honest with you, are always at the forefront of my mind. And that's why I'm quite glad actually to say that I've never really needed anyone externally to kind of give me some kind of like to hype me up or give me some kind of pep talk or anything, because it genuinely has always come from within. And again, I'm a big believer that everything happens for a reason in life, and things that you have or don't have will mold your opinion of things as well. So what I mean is, having quite a basic childhood and upbringing, as amazing as it is and was, now that I look back, at the time it didn't always feel it. And I remember having that kind of that fire in my belly at the time, thinking, you know what, I think I want a bit of this or a bit of that or something, you know, some nice materialistic things when I grow up. And naturally you start to think along the lines of thinking outside the box, pushing yourself and achieving more. So I think for me, it has always just been there from within, to be honest.
I find it interesting. I mean, you've got the same sort of background as me, and you've obviously gone into education a lot earlier. But then I find it interesting that you've then made a pivot from. I'm going to guess you went to work in dentistry first, and then you've gone self-employed. So you've worked.
Yes, so basically, all dentists are self-employed, except those who work in salaried services such as the community. But all kind of dentists who are in general practice, so you're kind of like, you know, high street practices, will all be self-employed. And then obviously you can either work for the NHS or you can work privately as well.
So everyone has to make a decision whether they're going to go out on their own or they're going to work for the NHS and start their own business. Either way, they're self-employed.
Yes.
So, okay, but then this is an interesting question. So you study dentistry. Do you get taught anything about business along the way? Or like, do you get taught how to start?
This is such an amazing question. And honestly, this is something that gets discussed in dentistry and amongst my colleagues so much, is that there's a huge emphasis on consent. There's a huge emphasis now on communication. There's a huge emphasis on the practicality of dentistry. And, you know, you do practice things, obviously, in dental school under supervision a lot. The one thing that they do not teach you about is the business of dentistry. I think we had one 20-minute short talk on it in our final year, just before getting kind of chucked out into the world of work. And it was very basic. And you come out and you just have to learn as you go along. So I'm very grateful that I've always had good mentors around me. I've had, you know, my trainer, because you have to do, after the 5 years of dental school, you have to do one mandatory training year here as well in the UK. And I had an amazing trainer who taught me so much about the business side of it. But I think the best thing he probably taught me was, don't stress about it. Just take it in your stride and learn as you go on. He said, you know, the more you try and learn straight away, it can work against you in so many ways as well. So he said, just learn as you go on and it will all fall into place. And it does. But it would be nice sometimes to be aware of even the basics before you come out. Because obviously that is sometimes a cause of anxiety itself, just the fear of the unknown. But
I feel like that's what holds a lot of people back. They go, I don't know what I'm doing, but you guys don't have a choice. You just have to do it and figure it out. Like, that's it.
Yeah, and I guess because there's so much else going on, dentistry is one of those topics where you've got the hands-on element. You know, you're always having to keep up with your admin and your patient's clinical notes and all that kind of stuff, and then your records, like your photography and all that side of it. There's so many facets to dentistry that, to be honest with you, business is just one of them. Whereas in the majority of businesses, it's, you know, the business and then the business of the business, is in like the bottom line and all the finances and all that kind of stuff. But there is a lot to kind of get your head around with dentistry. So a lot of the things kind of basically keep you occupied up until the point where you kind of think X amount of months or maybe a year down the line, wait a minute, I think I need to start thinking about my finances. And the nice thing, I guess, in dentistry is that first year you do that is that's the mandatory training year, is a salaried year. So basically you're not worrying about finances, so you can kind of get your head around all the other stuff and then make a decision as to whether you want to remain salaried, go self-employed, or however you want to do it.
So if you've got someone who's looking at starting their own business and they are in the same shoes, they probably have no idea what they're doing. What would you say to them?
Honestly, I'd say there are lots of resources now available to help you kind of educate yourself and learn more about it, but go with your gut instinct. And that is a key thing that I've always done as well. So basically, with regards to remaining employed or going self-employed, working for the NHS, going private, I would certainly always advise initially for at least a few years to remain in the NHS, because it is, well, for two reasons really. Because first of all, it is something that I'm a big believer in. My family have always been extremely well looked after by the NHS, extremely well supported. The NHS is very close to my heart for many reasons, so I'm a big kind of supporter of the NHS. And secondly, it's amazing for experience. So, you know, it affords you the opportunity to look after patients in a very, you know, reasonable manner, with so many clinics providing good NHS dentistry, and then after that decide what you want to do. But yeah, always go with your gut instinct and just go with the flow, because it will come naturally over time as, you know, you begin working, and all the rest of it just falls into place.
I'll ask two more questions, I guess. The next question is, what's next? Where do you see the surgery going?
So with regards to, at the moment, I'm working in Manchester and in Liverpool as well. So I'm so comfortable. So it's one of those things where, like once you are very comfortable and you're doing what you enjoy, for me, the key thing is, if I wasn't able to see the kind of clients and patients that I see and do the smile makeovers that I'm doing, I'd probably be thinking right now, I need to make a change. But sometimes when what you're most passionate about, all them boxes are being ticked and you're very comfortable, it just makes you think, for the time being, I'm just going to enjoy it. Because there comes a point where there are so many levels to your education, to your experience, and to gaining a skill set. Sometimes you just have to take a moment to stop and think, even if it's for 6 months, even if it's for a year or two, I'm going to enjoy this level. It's not always just about jumping straight away to the next level. And I think a lot of people do that, but they just miss out on so many amazing experiences along the way because they've just reached somewhere and straight away they're thinking, I need to get to the next level. But I'm at a level now where not only have I worked extremely hard for it, but I'm so happy and content. So I'm going to enjoy this level for a bit longer and then contemplate what to do next and how to grow. Because again, as a natural workaholic, that's always at the back of my mind as well. Continuous growth and wanting to achieve more, which is an amazing thing because that's where, I was saying before about the fire in your belly, that's where that comes into good use. But sometimes you have to enjoy where you are at as well, I guess.
Yeah, no, I agree. I'm a little bit opposite. I just try and balance the next level every time I get opportunity. But you're right, I don't actually stop spend. I never actually enjoy any of it. I'm like, right, next, what's next? I would say the last question is what I told you to prepare was if you go back and talk to yourself, let's say before GCSE, so like you're in year 10, 11, whatever, year 11 is it? Last year of school?
Yeah.
You're looking ahead at your future. What would you tell yourself? What advice would you give yourself?
That's an amazing question. So genuinely, the advice I would give my younger self would be never to worry about what anyone else thinks. At that age, you are so impressionable and you are so susceptible to other people's opinions, comments, critics, it can be quite harsh comments sometimes as well. But whether it's personal, whether it's through the academic life, whether it's through with whatever, always believe in yourself and always understand that no matter what happens, you can achieve your goals. No matter what your background is, you can achieve your dreams. You can enter any profession you want as long as you put the hard work in and you believe in yourself and don't let critics put you off. And the other thing I'd say is maybe coming a few years after year 11, as you kind of enter your working life, is that critics and what we call these days kind of haters or whatever you want to call them aren't always a bad thing. And one thing I'm realizing now is when people start to critique you, and as they critique you more, which naturally will happen to all of us at some point, it's not always a bad thing. And often it's a sign that you're probably doing something right. So, yeah. That's
something I tell myself as I cry. If they're hating on you, it means that you must be doing the right thing, surely. Nah, it's true though. It's people don't hate people that are doing worse than them. They don't care about those. If someone starts making moves, that's when they panic and then they start showing.
Yeah, and it's just that age-old story of like kind of you do something, initially people will probably like insult you a bit, they'll be quite surprised or shocked, they might even laugh at you. And honestly, it's the power of continuity. The more you do it, the more they become desensitized to it, and then they start to question themselves. And then they think, wait a minute, should I be doing this? Is this guy doing something right? Like, why are people starting to like it? Why are they starting to get used to it? And honestly, the number of times things like that have come full circle where you think, you know what, I'm going to continue because just because you can't fathom it or just because you can't comprehend it at this point in time, it's not to say that I'm doing the wrong thing or that it's not going to be a big success.
No, I agree completely. And I think after a while, they start to ask you how you did it. Okay, cool. If someone wants to find you on Instagram or Twitter, or how did they do it? What's your app?
So it's my app of choice is always Instagram. It's at dr.ansar, and always happy to help with anyone that would want their teeth sorting out or smiles or even some advice. It's not always, I'm very much about less is more. So that's my philosophy in dentistry is it's always about kind of a less is more philosophy of minimally invasive dentistry. I know we've had this discussion as well. So, it's not always what a lot of patients often think, I'm going to have to get a decent smile, I'm going to have like my teeth drilled away or anything like that. Not at all. It's we always try and keep that to a minimum and still achieve like a lovely result.
And you're based in Bury as well, so a lot of people...
local lad in Bury, so, everyone's always welcome here, so 100%, yeah.
Sweet, well, thank you very much for chatting to me, buddy.
You're very welcome. All the best, Lewis.